Welcome friends, in today's video, we will learn CNS infections by using some questions. 1. Define the term meningitis. Meningitis refers to the inflammation of the meninges, leptomeninges, and the subarachnoid space. 2. What are the different types of meningitis? Meningitis can be categorized into acute, subacute, and chronic forms. 3. Describe the primary routes of entry for infections into the central nervous system. Infections enter the kines through hematogenous spread, arterial or retrograde venous spread, direct implantation, trauma lumbar puncture, local extension from chronic sinusitis, mastoiditis, osteomyelitis, especially viruses like rabies and herpes, especially viruses like rabies and herpes zoster. 4. How is meningitis classified based on etiology? Meningitis can stem from various causes, including bacterial, viral, mycobacterial, such as Mycobacterium tuberculosis, fungal, parasitic, and non-infectious factors, e.g. chemicals, chemotherapeutic agents introduced to the subarachnoid space and meninges infiltrated by malignancies. 5. What are the key organisms responsible for bacterial meningitis and their age-related occurrences? The causative organisms for bacterial meningitis vary with the patient's age. Neonates commonly face group B streptococci, E. coli, and Listeria monocytogenes. Children and young adults encounter Neisseria meningitidis and Streptococcus pneumoniae, while Streptococcus pneumoniae and Neisseria meningitidis become more frequent in middle-aged and older individuals. 6. Explain the types of viral agents contributing to meningitis. Viral meningitis is usually caused by enteroviruses, mumps, and Mycobacterium tuberculosis, leading to milder forms of the disease. 7. What are the organisms responsible for meningitis in unique clinical situations? In specific clinical conditions, patients with splenectomy are vulnerable to Streptococcus pneumonia, while immunocompromised individuals can face Listeria monocytogenes, Gram-negative bacteria, anaerobes, Mycobacterium tuberculosis, Cryptococcus neoformans, fungal, and Cobacterium tuberculosis, Cryptococcus neoformans, fungal, and HIV viral. Trauma and neurosurgery can introduce Gram-negative bacteria, anaerobes, and Streptococcus pneumonia, especially causing recurrent meningitis in patients with basal skull fractures. 8. Describe the characteristics and potential complications of acute pyogenic meningitis. Acute pyogenic meningitis, caused by pyogenic bacteria, is identified by the accumulation of creamy, opaque exudate in the subarachnoid space, dull, opaque meninges, and prominent congested blood vessels. Untreated cases may lead to fatal complications, including infiltration of the brain by organisms, cerebral abscess, ventriculitis, thrombosis of veins, and fatal outcomes. 9. Explain the clinical features of acute pyogenic meningitis. The clinical manifestations of acute pyogenic meningitis include fever, headache, drowsiness, irritability, photophobia, neck stiffness, and seizures. 10. Define cerebral abscess and elucidate its characteristics, spread, and clinical presentation. A cerebral abscess is a focal area of suppuration with liquefactive tissue necrosis in the brain. It commonly arises from a mixed bacterial infection spreading through direct implantation, local extension from adjacent foci, or hematogenous spread. Its clinical features include fever, symptoms of space, occupying, lesions, seizures, and focal neurological signs. 11. Highlight the complications associated with cerebral abscess. Complications of cerebral abscess encompass increased intracranial pressure leading to herniation, abscess rupture resulting in ventriculitis, meningitis, and venous sinus thrombosis. 12. Describe the types of tuberculosis affecting the kines and their complications. Tuberculosis of the kines can manifest as tuberculous meningitis and tuberculoma. Complications include obstruction of ceph flow, cranial nerve palsies, brain infarctions, and focal neurological signs. 13. Elaborate on the various forms of neurosyphilis and their clinical presentations. Neurosyphilis can present in the form of meningobascular neurosyphilis, chronic meningitis with fibrosis, general paresis, cerebral neuronal loss and atrophy, tabes dorsalis, spinal cord demyelination, and gumma formation. 14. Explain encephalitis and its specific types, their associated clinical symptoms. Encephalitis is characterized by brain parenchymal infection associated with meningeal inflammation, meningoencephalitis. The specific types involve poliomyelitis, rabies, and subacute sclerosing panencephalitis, SPE, resulting from persistent measles virus replication causing neuronal damage. Clinically, encephalitis usually involves diffuse brain involvement, leading to cerebral edema, perivascular cuffing of lymphocytes, and multifocal gray and white matter necrosis. 15. Describe the effects of hive on the brain, including direct and indirect impacts. The effects of hive on the brain encompass progressive dementia due to hive meningoencephalitis, AIDS, associated myopathy, peripheral neuropathy, and opportunistic infections such as mycobacterial infections, toxoplasmosis, and Keen's lymphomas,